Well, thanks everybody. Thank you so much for joining us today. It's always a pleasure to be here in Lethbridge, in the heart of the Blackfoot Confederacy. And of course, we gather today on lands where people have been gathering for thousands of years to build community. We are here, as I said, on the lands of the Blackfoot people on the Great Canadian Plains here in Treaty 7 territory, which also includes the Stoney Nakoda people, the Mountain people, as well as the Beaver people, the Tsuut'ina Nation, and the Métis Nation of Alberta with their long history and deep connection to this land. So thrilled to be here with all of you today, but not thrilled about the subject matter. I'm Naheed Nenshi, I'm the leader of Alberta's New Democrats, and today I'm joined by Rob Miyashiro, who is our incredible candidate for the upcoming by-election here in Lethbridge-West, and behind me, a number of concerned citizens, including Dr. Vincent Hanlon, a retired emergency room physician, John Wildman, whose doctor made the very difficult decision to close his practice here, and Jody Asselin, who now has to travel to Milk River with her family to see her family doctor. And you'll hear from Rob and Jody very shortly. I'm here today because we have a by-election, because Rob needs to be elected as the new MLA for Lethbridge-West to fight for better health care. But I'm really here today because Lethbridge is ground zero for the healthcare crisis that we're seeing here in Alberta. I've been with him on the doorsteps, and as we talk to people, the number one issue people bring up is the state of the healthcare system. Too many people, nearly 1 million people in Alberta, simply don't have a family doctor. And today we had an announcement from the Minister of Health, which is absolutely the epitome of shuffling deck chairs on a sinking ship. The announcement said nothing about getting more family doctors. It said nothing about paying family doctors reasonably. It said nothing about improving people's access to primary care. Instead, we have a new CEO and a whole set of new managers to develop a new system that still doesn't have any money and still doesn't have any people working in it. And to me, that is the best example of what this government loves to do. They love to have meetings. They love to set up management. They love to waste money. They love to pick fights. What they don't love to do is solve the problem. And beyond family medicine, we know that Lethbridge's jewel, one of Lethbridge's jewels, is the regional hospital. That hospital is bursting at the seams. And despite years of UCP promises, it still doesn't have the cardiac care facilities that they keep saying they'll fund and never actually fund. Rob knows all this. Rob, in particular, spends his life working with seniors. Soon we'll have announcements on continuing care, yet another example of the UCP creating more management, creating more administration, and not actually solving the problem. Because let me tell you, when it comes to healthcare, the UCP does not get it. I will remind you that 2 years ago, when Danielle Smith became Premier, she said, I am going to solve this problem. I'm going to fix healthcare in 90 days. Well, it's been many multiples of 90 days, and healthcare is far from being fixed. Not only did she break her promise, she has no idea. Let's let that go by. Not only did she break her promise, she has no idea how to actually fulfill that promise and fix healthcare. And the reason we're standing on this particular street corner today is because I was shocked to learn this month that 2 incredible, dedicated, brilliant family doctors announced they're closing their practice here in Lethbridge simply because the UCP has made their life way too difficult. So we have a chance to send a message. We have a chance to send a message to the government, to Premier Smith, to Minister LaGrange, telling them you failed us on healthcare and we've got to do better. That is why the good people of Lethbridge-West should elect my good friend Rob Miyashiro, and I'll turn it over to Rob.
Thank you so much, Ned. Thank you for making time to be with us in Lethbridge again. We've been knocking on many doors in the last couple of weeks, and what we're hearing is that, people deserve better health care than what the UCP has delivered. Everybody in our community deserves a family doctor. But the shocking news this week was that 2 of our excellent doctors in the clinic right behind us are leaving, and part of that reality is because of the UCP government. We should be welcoming doctors to our community, not seeing them close up their practice. And I have some news for the UCP because they don't seem to get it. It's impossible to find a family doctor in our community. But don't just ask me. Check the primary care network's Find a Doctor tool. Well, you find a doctor in Lethbridge and there's nothing that comes up. Or it's so outdated that you just phone a clinic and there's nobody there. Or when clinics bring doctors in, because of the doctors that have left, they're just backfilling the people that have left. Today, in our city, there isn't a single family doctor accepting new patients, and that's a tragedy. With the loss of 2 more doctors, where are the patients supposed to go? Emergency room? We know how overcrowded the emergency room is, and we know that's not the best place for people to just get active treatment. Danielle, as Naheed said, Danielle Smith promised to fix healthcare, and she broke that promise. That's why in this upcoming by-election, I'm prepared to fight for the people of not just Lethbridge-West, but for people in all of Lethbridge. And that includes making sure people have access to a family doctor when they need one. Now I'd like to turn it over to Jody Aslan, who will say a few words about what the loss of their doctor will mean to their family. Jody?
Hello everyone. My name's Jody Aslan, and my family of 5, including 3 children, lost their family doctor when they chose to leave the Campbell Clinic, which is right behind us. We've seen this doctor since we moved to Lethbridge roughly 9 years ago, after moving here from Edmonton. And many of our friends and colleagues no longer have family doctors, so we always counted ourselves quite lucky. And I guess we always knew this might happen, but it still came as quite a shock. I guess it's not a surprise, but it's scary to know that this is where our system is. And I do understand that this is a national issue, but our provincial government is making things worse, not better. We were incredibly lucky to find a new family physician quickly, but that clinic is in Milk River, which means our family needs to travel 85 kilometers out of town. But I'm so happy we at least have something. And I think anybody who has a spouse or children doesn't want to feel vulnerable and scared if anybody got sick or needed care. I definitely can't blame our doctor for leaving. People need to work in supportive places, and I just can't see why a family physician would stay here and practice in Alberta when there's other provinces that they could practice in. I would say though that my family and many families are more vulnerable, and our children are more vulnerable because of this, and I would like to see something change. Thank you.
So we have a chance to take some questions now. If you do have a question, just raise your hand. I'll hand the mic over. Just say the name of your outfit, please.
Hi, Quinn Keenan with CTV News. I know you had already touched on just being against this new announcement from the province that came out here today, but I guess just could you go into specifics about this plan and just how you think this is going to impact Albertans who are looking for a family doctor and are maybe just not having any luck finding one right now?
You know, through the Thanksgiving long weekend, we knew that Minister Adriana LaGrange was going to make a big announcement on primary care today. So you can imagine that for my long weekend, I was thinking, what is she going to say? I got a news conference. I've got to have answers. We thought perhaps she would finally announce the new compensation model for primary care physicians that has been stalled for about 7 months in this government. She didn't announce that. We thought she might announce a new plan on training more family physicians, especially to work in smaller places and rural Alberta. She didn't announce that. What she did announce was the rollout of a new organization that, near as we can tell, the only difference it makes is there's a new CEO who's got to get paid, there's a new management layer that's got to get paid, and all of your physicians who have Alberta Health Services email addresses will likely get new email addresses at Primary Care Alberta. I'm sure we're all excited about the new email addresses. But what we didn't hear was anything about solving the crisis that we have today. And in fact, if you look at the foundational principles of the new primary care organization, it talks a big game about nurse practitioners and increasing primary care networks. It doesn't talk about increasing access. It doesn't talk about funding primary care. It doesn't talk about recruiting family physicians or paying them so that they don't leave. And I think that's very telling that we've created a new organization, but the real decisions on funding and on training will remain in the minister's office, will remain with Alberta Health. So this new organization is nothing but window dressing.
And what system would you like to see implemented instead of the one that was just announced here today?
Well, the first thing is we have to finalize the payment model for primary care physicians. We're hearing from physicians everywhere that they just don't make any money for the jobs that they do. I sometimes say that our system should be based on family physicians being the highest paid specialists, not the lowest paid specialists. That's probably not realistic, but the first thing we've got to do is finalize the payment model. Beyond that, once that's in place, then a lot of things will be able to change in terms of how physicians recruit panels. The second thing is that we need to be able to bring more family physicians into Alberta, and that doesn't just mean competing with other jurisdictions. It means providing incentives to students in medical school to go into family medicine as a specialty. It means figuring out how to get international medical graduates more quickly into the system, building up their credentials to be family physicians. So there's a lot of systemic work that needs to be done. There's a lot of money that goes into this, that needs to go into the system. But most important, we have to start treating physicians with respect, not with the contempt that the government deals with them now.
Just one question, Lyden Hickok with Bridge City News. I just wanted to touch on the statement that LaGrange. Pardon me.
For future reference, busy street corner may have not been the smartest thinking for this particular news conference today.
Just one question regarding the statement that LaGrange issued after the announcement of the primary care health system regarding the increase of physicians in the province. She says there's been a 4.5 increase of physicians over the last from 12,126 physicians of an increase of 518. She said in a quote that this demonstrates that our efforts to attract and retain physicians are paying off, but we recognize there's more to be done. What are your thoughts on that there has been an increase of physicians, but there's still a struggling of people needing family doctors and such?
If it were true, I'd be very happy that we're at least taking first steps. The problem is it's not true. So as Dr. Luann Metz, who is the chair of our Commission on the Future of Healthcare, will point out, that is registered physicians. It doesn't mean people actually accepting patients. And when people retire, they usually stay on the registry. When people move, it takes a long time to get off the registry. So the proof's actually in the pudding. When you go to the Find a Doctor website, you will see that there has not been a single family doctor accepting new patients in Lethbridge for nearly a year. So we can talk about stats all we want. The reality is the number of family physicians practicing in Alberta is only going down.
I'll just move over. Justin Sibbett, Global News. Rob, I've got the question for you here. You say that you're going to come in and, should you be elected, you're going to fight for Lethbridge. What's it actually going to look like, as you, of course, would be in a minority party?
Also, it's going to be the same as what's been happening, as Naheed said, with Dr. Luann Metz and with Sarah Hoffman, that are raising issues in the legislature all the time. So I can talk all I want in my position that I'm in right now and working with seniors and have those discussions about what the healthcare system looks like for seniors. But when I'm in the legislature and I can raise this so that everybody in Alberta knows the problems that we're having in Lethbridge, it puts a different perspective on it. It tells them that the third largest city in Lethbridge is experiencing a healthcare crisis and that we need to do something about it. And as Naheed said as well, there are some steps that need to be taken in order to get to the outcomes that we want. And it's perhaps the UCP isn't doing those things that we need them to do to get to the outcomes we need in Lethbridge.
Can I jump in on that one, Rob?
For sure.
Thanks. That's a terrific answer. But the other thing I want to mention is that we are approaching healthcare differently than the UCP has done. So I have appointed Dr. Luann Metz, MLA for Calgary Varsity, as the chair on a commission of the future of healthcare. So the idea is, while we're in opposition, instead of just opposing and being critics, we are actually working with stakeholders across the province, with experts and others, to develop a new vision for the healthcare system, to cost it out and to figure out what it looks like, so that when we go into the election in 2027, people will know exactly what they can expect for the future of the healthcare system, instead of this government making decisions on a very spontaneous basis. I call them the pinball government. They just careen from crisis to crisis. No experts have suggested that you're going to reduce the amount of management in Alberta Health Services by creating 5 layers of management where there used to be 1. By the way, everyone thinks there's 4 new organizations. The minister quietly announced a couple weeks ago that there's actually a 5th new organization. The 5th organization is called the Integration Council, trying to get the other 4 organizations to work together. I kind of have a different way that you could get 4 separate organizations to work together. Maybe 1 organization? Don't know. But the point being that we are actually working with experts and with Albertans to create a better vision of the system going forward. Do you have a follow-up?
I do. Just, I guess, with your plans moving forward, should the NDP get into government in a few years, how much money are you looking to increase on a dollar figure?
Look, it's going to take money. And one of the reasons that we're doing all this work is to cost out what a better system would look like. But I'll give you an example. The deal with the family doctors will cost, if memory serves, about $250 million. That feels like a lot of money. But family doctor compensation in Alberta is over $6 billion, if I got my numbers right. So, significant but relatively small amounts of money spent in the right place will really make a difference for people. Now, I may have those numbers completely wrong, but the quantum is correct. That, it's a lot of money, but in the grand scheme of what we spend on physician compensation and on healthcare, it's not that much, but it'll make a huge difference.
I guess just one more question just for Rob here. for Rob, pardon me. I just wanted to ask about your competition in John Middleton Hope. He is a popular figure in Lethbridge, as you know, but you're also popular, especially with the senior community. What do you think you stack against him in this upcoming by-election?
Well, interesting question. So it's as much as it's John's the candidate for the UCP, it's also about the ideals that the UCP represents. Not just John. John's a good guy. I know John. We get along great. So it's not as much me against John as it is the people of Lethbridge against the ideals that the UCP has put forward, not just in the last year and a half under Danielle Smith, but the last 5.5 years, right? So it's not just that. What they have to carry as a party is what they've done to our province in the last 5.5 years, and compounded by Danielle Smith in the last year and a half. So yeah, John and I are the names on the ballot, but this is definitely a vote of the citizens of Lethbridge and Lethbridge-West of their confidence in the UCP to carry on doing what they're doing, or to send them a message to say, no, we've had enough and we want a different voice in Lethbridge.
Okay. Right. Before you all go, I'm going to give you a little bonus. There's a little more news this morning, and some of your colleagues in other newsrooms have asked for some audio and video, so I'm going to pretend you asked me a question and answer it anyway. So this morning, Canadians across the country woke up to their daily newspapers with a giant wraparound ad from the government of Alberta around stopping what they're calling a production cap. This is typical Danielle Smith and UCP. They're spending a whole bunch of taxpayers' money in places like Halifax to try and influence the upcoming federal election instead of actually solving the problem. Had the Conservative government here in Alberta sat down with the federal government and explained to them, you know what, in Alberta we already have an emissions cap. It was put in under Rachel Notley. We kept it under Jason Kenney and Danielle Smith because it's good public policy. It encourages innovation and it helps the energy industry be better. And by the way, we've also achieved record production with the emissions cap in place. But instead of doing that, they picked a fight with the federal government. They got the federal government entrenched in a view that is bad for Alberta, and we're going to have an emissions cap that may well restrict our ability to increase production going forward. But you don't fix that by spending untold millions of dollars of taxpayers' money on advertising in Halifax. You fix it by going to the table. And once again, we've got a government that would rather fight than win. And an Alberta New Democrat government just wants to win for Albertans. All right, anyone else? Okay, thank you all. Thank you very much, and thank you all of you for being with us today.